This is The Big Story presented by HerbChambers.com.
We're at Brigham and Women's Hospital in Boston, where doctors just announced the first full transplant of a patient in the United States. It's a 25-year-old man from Dallas. His name is Dallas Weens, and he had lost his face, his entire face, in a horrible accident a couple of years ago. He was painting, and it hit a high voltage wire, and it burned off his entire face. And so doctors here at Brigham and Women's, a team of about 30 doctors and caregivers, anesthesiologists, nurses, had spent about 15 hours putting a new face on this young man. They gave him nose, cheeks, lips, the whole entire face. And they're saying now that he's already awake. They did it sometime last week. They haven't said exactly what day because they were trying to protect the donor's identity, but it was sometime last week. And already Dallas Weens, this young man, is able to walk. He's able to talk on the phone. He's called his family back in Texas on the cell phone. He has a 3-year-old daughter, Scarlett. Just very excited about going back to see his family. They say that he will be able to, for the first time, be able to feel his little daughter's kisses on his lips, and he's lost all sensation. So doctors are very excited. This is the first full transplant in this country.
It never reaches completely normal, but he should regain sensation of his forehead on the right side, right cheek, and most of the upper and entire lower lip. There were a couple of nerves that were damaged too severely, so his part of the left cheek and left forehead will be probably minimally sensate. I think the next milestone will be really to get him out of the hospital, and then in foreseeable future back to Texas. But recovery of the nerves will take months, and right now he will be just like all the other patients. We're just hoping that everything will continue to heal well and stay perfused.
It definitely is a miracle. And when I first saw him after the injury, I had no idea what was going to follow. But he is determined to get well and to move on with his life and to make something of his life. But this is beyond anything that I even thought would happen when he first received the injury.
There are 2 more people on the list for this transplant already, including a Connecticut woman who had had her face molded off by a chimpanzee a few years ago. She is one of 2 people that they say they may consider next to do this procedure. Again, of course, 2 years ago they gave the second transplant in this country. It was a partial facial transplant to a man named Jim Mackey, who they say now is doing great and is on very low-level anti-rejection drugs, and he is doing phenomenally, they say, and they hope that Dallas Weens will, in a year or so from now, be doing just as well.